GPS is a product that nobody else has.
Navigation in the form of GPS allows you to see what you're doing while you're doing it.
It's not a robotic arm controlling what I'm doing, it's me controlling a very precise instrument.
When you use it routinely, the tougher cases become easier.
The lead time to use this technology is less than 48 hours.
If a surgeon thinks they don't need it, I think the answer is you don't know that you don't need it until you try it.
I think that navigation in the form of GPS right now is the most advanced version of that that's available.
GPS basically allows us to translate all of our preoperative planning to the operating room. And we spend a lot of time planning these cases, trying to get the best backside support for an implant or the best positioning of an implant to give better range of motion. This allows us to do that with a much more focused laser.
I found it to be time neutral, if not time saving, because the degree of confidence that gives you in the operating lets you move seamlessly through every part of the procedure.
What makes GPS so unique is it's really the only thing right now providing us real-time guidance, where we can make our preoperative plan and then we have real-time guidance.
I think one of the unique things that GPS offers is the surgeon is still in full control. So it gives me the option of controlling how deep I want to go with the reaming. It also gives you the option of converting between anatomic and reverse in the middle of the case.
The more accurate we get the position of the implant, the better the outcome is going to be for the patient. I think additionally, from a research standpoint for us, it also tells us where we actually put the implant, which nobody else has that available to them.
I think most orthopedic surgeons have a degree of postoperative film anxiety, wondering what the x-ray when they come to the office is going to look like. That anxiety goes away when you know that intraoperatively the implants are going exactly where you planned it.
If you try computer navigation, you'll realize how much more precise you can be and how much more efficient you can be.
Advita is able to deliver on that front to allow us to use technology to improve patient outcomes and allow surgeries to run more smoothly.
In a world of increasing complexity, clarity matters more than ever. Advita GPS delivers real-time insight, enhancing visualization and precise execution in shoulder arthroplasty. Surgeon-controlled, data-informed, no capital investment required. Advita GPS, guided by what matters most.